Good morning. Welcome to our webinar. My name is Gary Smith, and I am the director of the Center for Injury Research and Policy at the Research Institute at Nationwide Children's Hospital in Columbus, Ohio. I'd like to welcome you to today's webinar on the prevention of drowning among children and adolescents. The webinar is being hosted by two organizations. The first is the Trainees for Child Injury Prevention, which we refer to as T4CIP, and also by the Prevent Child Injury Coalition. T4CIP is a group of pediatric trainees, and that includes medical students, residents, and fellows from across the country committed to child injury and violence prevention. T4CIP develops outreach materials and strategies for one-day national advocacy campaigns, which we call Days of Action. This core group of trainees reaches out to other trainees, to training programs, and to other partner organizations at local to national levels to join in on the Day of Action. And today is one of the Days of Action. This is one that focuses on the prevention of child drowning. T4CIP is sponsored by the Center for Injury Research and Policy in Columbus, Ohio, and by the American Academy of Pediatrics section on pediatric trainees, and also on by the American Academy of Pediatrics Council on Injury, Violence, and Poison Prevention, and is supported in part by funding from the Centers for Disease Control and Prevention. The other organization, Prevent Child Injury, is a national coalition of organizations and individuals, including researchers, health professionals, educators, and child advocates, all working together to prevent injuries to children and adolescents across the country. And they do this through coordinated communication and through toolkits and other materials, so that they speak with one voice at the same time about important topics to help prevent injuries among children and adolescents. Membership is free, and so I encourage you to join Prevent Child Injury if you are not already a member. And the website is preventchildinjury.org. So that takes us to today's webinar, and I am pleased to introduce our webinar moderator, Dr. Ben Hoffman. Dr. Hoffman is a pediatrician and a nationally known and recognized expert in child injury prevention and education. He is professor of pediatrics at the Oregon Health and Science University School of Medicine. He is also the medical director for the university's Tom Sargent Safety Center and director of the Oregon Center for Children and Youth and with special health needs. He is president-elect of the American Academy of Pediatrics. And, I have to say on a personal note, I've known Dr. Hoffman for years, and I've had the pleasure of seeing his amazing commitment and passion for the well-being of children and their families. He's knowledgeable, and he's an effective advocate, frequently appears on national media, testifies before Congress, and is a tireless champion for an equitable and safer world for children. So we are privileged to have him today as our moderator. So I'm now happy to turn the program over to Dr. Hoffman. Thank you.
Thank you, Gary. That was really kind. I'm really excited to be here. I'm getting to work with the panelists, getting to work with the team is a real privilege, and this is the stuff that gets me out of bed in the morning. In addition to all of the nice things Gary said, I'm also the immediate past chair of the Council on Injury, Violence, and Poison Prevention for the AAP, where I've had the opportunity to work with Gary and with Dr. Sarah Denny, who's going to be presenting today. I've also had the pleasure of working with Dr. Adam Katchmarchi, who you're going to meet in a few minutes. I was involved in injury prevention for 20 years before I really got engaged in the issue of drowning prevention. And I've always felt like injury prevention does not, but we know for a fact that injury prevention doesn't receive the attention that it deserves within training, within the practice of pediatrics, within communities. We know that unintentional injury is the leading cause of death for kids. And we also know that we're not really trained to be able to address it. And I felt like injury prevention is an orphan within the world of child health. And if injury prevention is an orphan, drowning is the loneliest, saddest orphan sitting off in the corner. And I got engaged in drowning prevention because families called us out on what we're doing. That's a story for a separate time, maybe over a beer or something like that. Happy to share. But I'm really excited about today. I'm really excited that we're going to be engaging in a social media storm to sort of raise the awareness on National Water Safety Day. And really thrilled that we now have 87 attendees who are here. And I look forward to having the chance to work with all of you, not just on this, but as we go forward, because we think about this as sort of a down payment for the future. So I want to have each of our panelists introduce themselves. So I'm going to start out with Dr. Sarah Denny, if you'll introduce yourself, and then I'll go down the line.
Sure. Thank you so much. My name is Sarah Denny. I am a pediatrician at Nationwide Children's Hospital in Columbus, Ohio. Also served on the AAP National Executive Committee on the Council on Injury, Violence, and Poison Prevention with Ben. And in that role was the lead author on the American Academy of Pediatrics policy statement and technical report on prevention of drowning. I'm a mom. I am involved in my community. I grew up at the pool as a lifeguard instructor, as a swim lessons teacher. So this is definitely an area of passion for me, and I'm really excited to share some of that with you. And then I've also been on the founding steering committee for T4CIP and have been it's been such a pleasure to watch this grow, and the momentum of our learners and what they bring to this injury prevention conversation is incredible. So I'm really excited about this day of action.
All right, thanks, Sarah. And next, Tiffaney Isaacson.
Good morning, I'm Tiffaney Isaacson. I'm a senior injury prevention specialist at Phoenix Children's Hospital. I have had the pleasure of watching Dr. Hoffman teach car seats, and he is a dynamo. He's definitely very committed to injury prevention. I'm also a past president of the National Drowning Prevention Alliance. I'm very excited to be here today to speak with all of you, and I too always come through my perspective as a mother.
Thanks, Tiffaney. Next, Dr. Adam Katchmarchi.
Good morning, everyone. It's a pleasure to be with you. As Ben said, my name is Dr. Adam Katchmarchi. I am the executive director of an organization called the National Drowning Prevention Alliance. You'll learn a little bit more about the organization and our work a little bit later. I also have the privilege of serving as an assistant professor at Indiana University of Pennsylvania in the Kinesiology Health and Sports Science Department. My passion for drowning prevention started when I was a lifeguard and swim instructor, and I've been able to carry that the whole way through my career. I'm excited to provide some resources and talk drowning with all of you today.
Excellent. Thanks, Adam. And last but not least, Leland Brown.
Hi there, everybody. Leland Brown III. I'm the program director for diversity, equity, and inclusion at USA Swimming. And ultimately, I almost drowned when I was 17 years old. Going from almost drowning to becoming the director of diversity, equity, and inclusion at USA Swimming not only is a feat, but more importantly, I truly had to not only learn how to be safe around the water, but then learn in the adult years how to swim. And so drowning prevention is not only important to me, it's important, and it's a part of my everyday job. I'm currently in St. Louis sharing water safety tips with schools today. And so thank you so much for having me here. I'm looking forward to being part of the panel.
That's awesome. We're really excited to have you, Leland. All right. So with that, I'm going to turn it over to Sarah Denny, who's going to start us out talking about epidemiology and some of the science behind drowning.
Great. Okay. Thank you so much. So I will just say later in my slides, I have links to the policy statement. The policy statement is a document that basically goes through kind of the general facts about drowning, the data, and then our recommendations. The technical report, which is also linked at the end of my slides, is really a deeper dive into the science. So that is a very lengthy, comprehensive document, which I think is really interesting. But just so you know, like that's where the science comes from that informed the recommendations we make in the policy statement. And then there's also a fantastic toolkit that is also linked. So I'm going to go over just some important information that you may or may not already know about drowning, but I think will help you focus the work that maybe you can do in your community around prevention of drowning. Next slide, please. Can you go back one? There we go. Oh, okay, go for it. Yep. So I am just going to piggyback on what Ben was saying about injury prevention just before we get into drowning. Obviously this is the life work of many of us on this call, whether we're presenting or we're listening. Injury prevention is such an important piece of keeping our kids healthy and safe. And so I usually start every single talk with this slide. This is a screenshot. Screenshot from the Center or the CDC, which looks at leading causes of death. And you can see that in all kids over the age of 1, unintentional injury is remaining the leading cause of death in kids. So we have our work cut out for us. And today I'm glad that we're tackling one piece of that. Let's go to the next slide. So, Ben mentioned, the pediatricians getting called out for what we were doing. I would say it was more what we were not doing. And so one of the big pieces that I really hope comes from this day of action is for everyone to understand that drowning is the leading cause of injury death in kids 1 to 4 in the United States of America. This is preventable. We need to make sure that people understand that this is such a serious mechanism, that it is prevalent, that we are seeing this as the leading cause of death. Because if people don't understand or know that it's the leading cause of death, then they cannot take the appropriate steps to prevent drowning. Next slide, please. Okay, so who is at highest risk? Well, I just got done telling you that our 1 to 4-year-olds are at the highest risk. That is the leading cause of death in that age group. But we see a second peak in adolescents. And the reason for this is multifactorial. So in toddlers, they're mobile, right? So they're walking, they're running, they're very, very curious, they're very fast, and they have no sense of danger, right? So they are at huge risk for drowning. In our adolescents, it's sort of a different scenario. They often overestimate their swimming abilities. They often engage in more risk-taking behaviors, and then also can be experimenting with drugs and alcohol. They have that peer pressure angle going on. So multiple reasons why we see in adolescents that second peak in drowning. We also have to consider chronic medical conditions as potential risk factors. So our kiddos with seizure disorders, we need to be talking about water safety with those families. Children with autism, especially children with autism who tend to wander, really talking closely with families around supervision around water, or, especially those transition times. So child is transitioning from school to home, making sure that they're not having access to any sort of water. And then cardiac arrhythmias is less usual, but it's certainly something to think about when we have an unexplained drowning death. Could there be an underlying cardiac arrhythmia that could have contributed to that? Next slide, please. Okay, so, understanding the different risk factors for the different age groups is really key when we're talking about prevention. So our message isn't the same to every single family or every single kid, because I just talked a little bit about the developmental stages. So it's really important that we're counseling families appropriately. So in our infants, right, our kiddos less than 1, they're most likely to drown in the home. So in the bathtub, in water, like in a bucket, right? So talking to families about never leaving your child alone in the bathtub, even for a second, talking about emptying buckets of water, putting toilet latches on your toilet, those kind of things. In our preschool age, it is swimming pools, usually private swimming pools. And in this age group, it's typically when kids are not expected to be in and around water. So the child gains access to the pool at a time when they're not swimming. And then we have our teen population who are more likely to drown in open bodies of water for the reasons that I just described on the last slide. Next slide. So, what is our role? And I use the term healthcare provider very broadly here because I think it's really healthcare providers, injury prevention experts, anyone who is interacting with families and kids and has a vested interest in safety. Next slide. So, we need to be talking about this. We need to be raising awareness. If we just even at our 1 to 4-year-old child visits are saying the leading cause of injury death in your child's age group is drowning. I mean, the look on patients' faces or parents' faces, I should say, I mean, they're surprised. This is new news to them. And so then thinking about what risk factors that family or that patient may have that may put them at risk for drowning. And so, if you have a pool, then we need to talk about what prevention looks like. And, you'll hear throughout this webinar that there are layers of protection, and that's the key to prevention and drowning. And so pool fencing is one layer, and I'll talk a little bit more about that in just a second. Having a water watcher is key. There's that saying, if everybody's watching, nobody's watching. Having an assigned person to watch the kiddos in the water. Swimming lessons are really key, and I'm going to get more in depth on that in a couple slides. Wearing life jackets, and this isn't just for the kiddos, this is for the caregivers and the adult role models. And then knowing CPR. We know that bystander CPR is really key in the final outcome in following a submersion injury. Next slide. So, when we're talking about layers of prevention, we talk about swimming lessons, and that is just one layer. Just because your child took swimming lessons does not mean they're drown proof. Okay. We still need to have that supervision. We still need to be wearing life jackets when we're on boats. We're still doing all of those things, but we know that swimming lessons can decrease the risk of drowning in kids as young as 1 year old. Now, is that true for every 1-year-old kid? No, it really depends on that child. It depends on their development. It depends on, a lot of things about that kiddo. And so that is a decision and a discussion between the family and the pediatrician, but it is really important to start having those conversations at that 1-year visit. I get a lot of questions in clinic about the infant survival swimming lessons. And at this point, there is no evidence to suggest that prevents drowning. So I think that's another really important thing is let's look at the data. What does the data tell us? And then depending on where you, are working in the community that you're serving, there may be significant barriers to accessing swimming lessons. And so I think as healthcare providers or as swimming ambassadors, I think part of our role is to do our due diligence. And if we're going to be telling families to enroll their child in the swim lessons, is where in my community can my families go for swimming lessons? And can I work with those community partners to provide affordable, culturally competent swimming lessons and swimming lessons for children of different abilities? And so I think part of our job is really to say, I have a patient population who has a need, and we as a community are not meeting that need. How can we do this better to provide those access? Because I can't expect my families to put their child in swimming lessons at the expense of rent or food or those basic things. And so we need to be brainstorming other ways to do that and giving these kids complete access to swimming lessons. Next slide, please. Okay, so there are lots of opportunities for advocacy, and our policy statement goes through it in a lot more depth, but I just wanted to touch on a few just as leaders in the injury space. Next slide, please. Okay, so, one of the keys is if you're trying to figure out, okay, what can I do in my community? You need to first go look at the data and figure out what's the problem in my community? Where are kids drowning? How old are they? So I just pulled this Washington State data from their child death review. And you can see I highlighted 70% of their deaths are occurring in open water. Okay, so maybe the people working in Washington State want to focus on interventions focused on open water. So you need to look at the data for your specific community to figure out kind of where the biggest problem areas are and then how you can most effectively intervene. So I just wrote a couple of ideas of places you can look for data. The child death review is really fantastic. It really breaks down, the number of deaths in kids from drowning and then where those deaths occur. So I would highly recommend that if you're looking for information. Your state Department of Health, and then drowning prevention coalitions, which we're going to hear a little bit more about in just a few minutes. What work are they already doing? We all know not to reinvent the wheel. So like, can we identify some people who are already doing some work in this space and then lend our lens as a pediatrician or a healthcare provider and kind of work together in preventing these drowning deaths? Next slide, please. Okay, so, we talk a lot about fencing, and I cannot speak enough about fencing. It is the single most evidence-based strategy for preventing drowning deaths. We know that installation of a four-sided fencing, okay, so that isolates the pool from the house. It completely surrounds the pool, has been demonstrated to decrease the number of pool immersion injuries in young kids by more than 50%. This is a really important piece of prevention, because I mentioned earlier that these drowning deaths in the 1 to 4-year-olds mostly occur when the child gains access to the pool when they're not expected to be in the pool. So they don't have that constant adult supervision because the kid is not expected to be in the water at that moment. Now, one of the big pieces around pool fencing. So first of all, getting pool fencing legislation or policy in place is great. But if it's not enforced, and if there's not inspections being done, then that's really not effective. There's been a ton of work in this area in Australia, where they have found that the risk of a child who is in a space where there is three-sided fencing has twice the risk of the child who has a four-sided fencing situation, where that pool is being completely enclosed and separated from the house and the yard. We know also from Australia that government inspections raised the rate of compliance with pool fencing laws from 50 to 97%. So again, you can have laws all day long, but they're not going to do anything if they're not being enforced. And so that's been really key. Another study from Australia revealed that in the 5 years after enactment of legislation to improve the effectiveness of pool fencing, the number of private swimming pool deaths were halved. So we know this can be effective if it's done correctly. Boating laws. So, again, enforcement around life jacket use. Life jackets. So again, talking about access, not only, or is it the law that you wear a life jacket when you're on a boat, but if you have a novice swimmer in an open water situation, like life jacket loaner programs are a possible, community intervention. Aquatic environment safety, there's a lot of work and some policy around that. And then EMS systems, I mentioned earlier about that CPR, having early bystander CPR, having quick access to EMS and that pre-hospital care really can affect outcomes as well. So lots of different opportunities for advocacy to improve not only that primary prevention, but all the way along the pathway. Next slide, please. I think, we've used media a lot, and on this day of action, we're really leveraging our media platforms. And I think there's a lot of work that we can do here. I know I read and edited several op-eds and letters to the editor that I have. We have trainees submitting this week to just educate the general public. I do a monthly segment on TV, and I'm doing mine on drowning prevention. So really leveraging media as a way to kind of reach our communities is really powerful. I'm using correct terminology. I feel like I get, I don't know, Ben, I don't know how many interview requests a year talking about like dry drowning and secondary drowning. So really correcting misinformation, using the correct terminology is important. And then again, going back to that increasing awareness, talking about drowning as being that leading cause of injury, death in kids 1 to 4, and then the importance of CPR training. Next slide, please. I've mentioned partnerships several times. I just think partnerships and relationships are the key to advocacy. And advocacy is really one of my passions around all things child health. So, these are just some ideas of looking for partners in the community who can maybe increase access to life jackets at swimming and boating sites, increasing access to culturally competent water safety programs, but also differently abled children. And then increasing access to affordable, high quality swim instruction, I think is really important. Next slide. So for my piece, and obviously I'll be staying on and happy to answer questions. Again, drowning is a leading cause of death. It is preventable. Providers and parents need to understand the dangers and then how to prevent it. And I know that you're going to hear this from all the speakers, but this is something that my mentor when I was a resident said to me all the time. And I say it to my families, and I say it in every talk I do about drowning. But water safety is a life skill. All kids need swim lessons, and many of my families, the parents also don't know how to swim. And so, as a family, learning to swim in a way that everyone is comfortable, but having those basic skills. I say, I don't care if you're on the swim team. I don't care if you have the proper technique for breaststroke. That does not matter to me. I need to know that if you were to fall or get pushed into water over your head, you can get up to the surface, you can tread water, and you can get yourself over to safety. And I will just add as a side note, in my experience, and this is very anecdotal, this is not like evidence-based, but I often, both in my young kids and my adolescents, ask the child, do you know how to swim? And almost every time the kid says yes. And the parent will make like a funny face. And then I'll say, so what I mean by swimming is you're in water over your head. And then they're like, oh yeah, no, I can't do that. And so that's a really great teaching opportunity to point out to the parents that overestimation of skills, that many kids do think that they know how to swim when in fact they do not. And so just having those conversations is very helpful. And just, again, there's many opportunities for advocacy. We're going to hear from the other panelists about that as well. Next slide. So you guys will have access to these resources, but these are the 3 links that I mentioned at the beginning. And thank you. I'm looking forward to hearing the other panelists speak and any questions we have from our audience.
Excellent. Thank you so much, Sarah. Now we're going to hear from Tiffaney, who's going to talk about connecting the dots between drowning prevention and the numbers, what it really looks like on the ground. So go ahead, Tiffaney.
Thank you. I am really excited for the work that you'll be doing today, and I'm very excited to have this opportunity to talk with this particular group. The things that you learn through this process and the words that you share today will change the future. A day of action is one single day. And I think it's terrific to start this day of action on the right foot, to really understand the factors that go into drowning and the important tools that we can use to prevent drowning. What's really exciting to me today is to have an opportunity to talk with the healthcare providers of the future and talk about that neglected orphan, injury prevention, and drowning prevention. You do have a role going forward in injury prevention after today, regardless of the specialty that you choose. Perhaps our attendees will become primary care providers who talk about injury prevention day in and day out with families. But you can have a role in injury prevention in almost any specialty or action that you take by simply understanding what the experts are sharing with you today. So if you're in the ED in Washington State, as Dr. Denny shared, you see that so many of the drownings happen in open water. During the summertime when the weather's warm and families want to go out, perhaps as an ED physician, you share one quick tip with every single family who rolls through with a child. If you find yourself doing advocacy among vulnerable populations, that's a very important opportunity. Many of our attendees will achieve high levels of physician leadership, and I think we can see through the role models that we have today that being an advocate and role modeling what injury prevention conversations look like in the future is a terrific way to save lives. Obviously, research is super important, and I'm very excited to look at the resources that Dr. Denny mentioned. That Australian study, I have questions. It sounds terrific. When we look at injury prevention, we have to really recognize that disparity is present in how injuries occur, so equity is needed in terms of our solutions. And we saw some of the important risk factors that make a family at higher risk for drowning, such as the age of the child. Some minority populations are at higher risk than their peers. It's also important to recognize that poverty can raise injury risk for children across the board, including within drownings. And when a family is coping with instability, we see that injury risk for that family rises as a whole. So when we think about these high-level statistics, we really need to bring it down to a family level and a caregiver level and the level for the child. So as you share messaging today, think about which of the resources that you'd like to discuss can be taken advantage of by families at all income levels. And consider your audience. How would a family who's struggling with domestic violence manage to work in putting a fence in the backyard for them? Really think about what the families are going through. This was a very exciting opportunity for me because I was asked to share what I wish pediatricians knew and what I wish that they would do better. And what I'd like to say to you is that saving a life in any form is noble. And perhaps you'll find that you are a trauma surgeon in the future who performs a complex surgery after a handgun injury. You are equally as much of a lifesaver and a healthcare hero if you have an effective conversation with a family about where and how they can get a life jacket and when they can use it. And when we look at injury prevention, obviously it's a specialty for me or a passion for me because I chose to go into this field. The reason is because we can save lives so easily through injury prevention. It's a fraction of the cost of treatment, and it prevents the needless suffering that many of you will see as you go forward in your careers. Although injury prevention is achievable, it is not simple. Injury prevention, just like everything else that we do within healthcare, is a science-driven discipline. And so it's very important as you work through your messages today and the projects that you'd like to take on in your career in the future to really look at what is evidence-based, what is measurable, what is scalable, because we need solutions in our communities today that can really make a difference. The other piece of information that I'd like to see pediatricians be able to do better in the future is to keep learning and evolving. I love working with medical students because you're like sponges and you seek so much information, and it's a great opportunity to really fill your mind. But if your mind is only filled with what you learned today, in 20 years, you won't be an effective advocate for drowning prevention. Understand that the conditions that families live in communities today are very complex and they're changing very quickly. So it's important to continue understanding the data. It's also very important to continue to engage authentically at the individual and the community level. I like to say that we should seek first to understand, then seek to be understood. So consider things like social determinants of health and think about if you're a family who's coping with instability and poverty, swim lessons are very important for you, but what if you don't have transportation? What if you don't have childcare for the other child to get them to swim lessons? What if you're a refugee and you come from a country where you're fearful of the authorities? You might not want to call 911 after an injury occurs. So engaging with experts in groups like Prevent Child Injury, the National Drowning Prevention Alliance, the AAP, these help us to understand how we can make these resources available to families and really create actionable steps for families. Finally, I think it's very, very important when we interact with families that we always engage with them from a level of both compassion and respect. I think that really shows when I visit with families and I give them a chance to tell me their story, and I speak with them in a way that indicates that I know that they are doing the very best that they can for their child every single day. Their shoulders go down, they breathe more easily, and they're ready to listen to me. So as you take action in the future, I hope that you enjoy your opportunities to collaborate and to amplify these important messages. And I hope that you do continue to stay involved.
That's great. Thanks, Tiffany. All right, next we're going to toss it to Adam, who's going to tell us a little bit about the National Drowning Prevention Alliance.
Sure. Thanks, Ben. Well, good morning, everyone. So the National Drowning Prevention Alliance, we are a 501c3 nonprofit organization that I say really fulfills two separate and distinct roles. One is to truly be an alliance. Drowning is what I refer to as a multi-sectorial problem. There are a lot of different sectors. Healthcare, pediatricians, public health is just one of many sectors. There's also the fencing industry, as we've talked a lot about pool fencing already. There's the learn to swim industry. There are lifeguards and aquatics facilities. At the advocacy level, this also involves public policy makers and first responders as well. So really creating ways to bring these individuals and these groups together to collaborate. I've said for years, there's a lot of really good stuff happening in drowning prevention all over this country, but it tends to happen in silos. And, the statistics for drowning, unfortunately, are not getting better right now. And there's a lot of work that needs to be done, but oftentimes what we find is a lot of people recreate the wheel constantly. So NDPA's job is to stop that and to get people to collaborate together and share useful resources. And that leads me into our second purpose, which is to be a consumer and a professional resource for drowning prevention, education, and information that specifically for this audience you can share within your practice with the families that you touch and the communities that you serve. I'm going to really specifically focus on two resources available to all of you from the NDPA that you can start using today. One is a website called ndpa.org/layers, and that focuses on our approach to especially toddler drowning prevention, that focuses on 5 simple layers of protection that parents and families and caregivers can practice to reduce the risk of drowning. I think you've already probably caught on to this already, but there is no single bullet solution to solve the drowning problem. This takes a multi-preventative approach and to really reduce the risk. But there is always a risk of drowning. So we approach the 5 layers for our 1 to 4-year-olds as barriers and alarms, restricting the access to water and notifying if a child enters an area that they shouldn't be in. We focus on supervision, but it is really important to remember what Dr. Denny said, that 70% of our toddler drownings across the country tend to happen during non-swim times. So supervision is critically important, especially during swim times. But I am not a parent, but I know and have many friends that are parents, and sometimes they have to use the restroom, or sometimes there is someone at the door. So it is difficult to watch a child 24/7. And there's a lot of misconceptions with drowning. One of those being that, what drowning actually looks and sounds like. Hollywood has not done us many favors in the way of correctly portraying drowning. Many people think that it is a loud and pronounced event that will go on for a couple of minutes. Truly, especially with toddlers, drowning is silent, and it can happen as quickly as 20 to 60 seconds. So it's a very short duration time. Water competency is critically important. As we've already mentioned, AAP recommends, after talking with a pediatrician, that children can begin learning to swim and learning basic skills for survival in the water starting at age 1, as well as the appropriate use of life jackets in certain situations, as well as always being prepared for an emergency. We do put emergency preparation in our preventative steps because drowning is an accident. And one of the number one things that I hear from parents are the words, "I didn't know." I didn't know this would happen to me. I didn't know the statistics around drowning. I didn't know the simple safety steps. And there is sometimes a stigma with drowning that happens to families who have lost a child to a fatal drowning, is that they weren't good parents. But the reality is drowning happens to good parents. Drowning is quick. It is an accident. And many parents have misconceptions or have been given misinformation over time about drowning. So really making sure that parents understand the proper emergency steps, knowing how to make that 911 call. And as Dr. Denny mentioned, knowing CPR, especially with rescue breaths. This is not a response that calls for hands-only CPR. The best response we can give for a child who is drowned is CPR with breaths and compressions. Our layers of protection, even though ndpa.org/layers is designed to address the ages of most concern, our 1 to 4-year-olds, A lot of these layers can be used subsequently for our infants, our adolescents and teenagers, as well as adults. But we do need to reapply and look at the data to see where these drownings are happening. And again, we can't paint the United States as just a broad brush of how these incidents happen. There is very big differences between what we see for childhood drowning in Florida versus Washington State versus where I am in Pennsylvania. So really understanding the local issues in your community can make a huge difference. The second resource I want to share with you is ndpa.org/toolkit. This is a new resource we've just made available in the last month or so. One of the things that we heard when we especially started talking with pediatricians to figure out how could we help pediatricians embed water safety education into their practices. One of the things we heard is time is an issue. And we recognize the fact that many professionals, not just pediatricians, but all of the sectors that we try to address in drowning prevention, they a lot of times don't have the time to create a social media campaign or great infographics and resources and guides to talking with the media. So we've tried to provide all of those resources available for free to anyone in the drowning prevention community who wants to make use of these resources. As part of our toolkit, that includes social media graphics that can be used all summer long. That includes not just the graphics, but the copy and hashtag strategy, and those are available for posting on multiple platforms. We created last year a Layers of Protection animated video. This video is about 4.5 minutes long, but it walks families through the 5 layers of protection that I've already mentioned. That video is available in English and Spanish and can be downloaded from ndpa.org/toolkit. We also include social frames to celebrate water safety during our main months that we're likely to see drownings across the country. There are printables, posters, infographics, and checklists available to download as part of the toolkit, local government proclamations, and one thing that I love is tips and tricks when dealing with the media. We include sample press releases that can be used in the local community, as well as a guide for the most up-to-date drowning facts and how to clear up misinformation in the media. And there were also some sample blogs that can be copied and pasted right onto your website or areas that you use to educate families about the risk of water safety. The last thing I want to just touch on, one resource that I'm really excited about, we developed this last fall. We oftentimes as NDPA get asked about what is the best approach for swim lessons with young children. And unfortunately, as Dr. Denny already mentioned, there is a dearth of evidence regarding the best approach to teaching children ages 1 to 4 especially learn to swim or survival skills in the water. So in the absence, what NDPA has developed is a swim lesson checklist. It's a 1-page checklist that parents can download to take with them as they evaluate the learn to swim opportunities or options they have in their community. I really want to just highlight the fact that every community is different, but especially in learn to swim, that is also creates some really big disparities across the country. And not just in urban settings, especially in rural settings. I live in rural Western Pennsylvania, and this time of year, there are only 2 providers in my community for swim lessons. So making sure you understand what to look for in a learn to swim provider and making sure it's one that fits the family. The other reality that we try to address is the financial reality of swim lessons. So it does cost money, but many providers, and many parents aren't aware of this, many providers do offer scholarships available to families that may not be able to afford the regular price of swim lessons. And many families are, a little fearful to go and talk to a provider about that. So that is leveled into our messaging around swim lessons and the resources you'll see on ndpa.org/toolkit. And really just, encouraging families to go talk to their provider and seek out those resources to really prioritize getting children this important skill. And I also want to emphasize, to Dr. Denny's point, the importance of adult learn to swim. We have seen through our statistics that if an adult does not know how to swim, their child is less likely to learn to swim. And remember, if a child gets in trouble, that adult is likely going to be the rescuer. So making sure those adults have basic water safety skills, making sure they're able to enter the water and assist in that type of situation if they're responsible for watching children is really important. The last thing I'll say, before I turn it over to the next panelist, is as you go through our resources at ndpa.org, if you see something or don't see something that you would like to see available from NDPA, please let us know. Our job is to make sure you have the resources to be able to address drowning within your communities. And if we can create something that would be helpful to you, we would love to hear that and create that for you. So I look forward to any questions we have, and I'll turn it over to the next panelist.
Great. Thanks, Adam. And then we're going to hand it off to Leland to back cleanup from St. Louis.
Yes. So for myself, the big thing I want to ask all of you, and I know I can't see you at this moment, but the big thing I want to ask is how many people want to be extraordinary advocates in this space versus how many people want to be ordinary advocates? So if you want to be an extraordinary advocate, raise your hand, right? And I know you're at home, you're looking at yourself. I'm seeing some hands raised, some hands. I'm getting the little icons here to the left, which is super awesome. So I'm seeing a lot of hands up. And the only difference then I ask you between the word ordinary and extraordinary is what? The word extra. So if we want to be extraordinary advocates, we have to do extra. And sometimes that means going out into communities that we may not be as connected with. That's extra work, right? Sometimes that means we may have to take kids, transport them quite literally to lessons. Sometimes that means even if it's not your role, you have to be in schools teaching kids about the importance of water safety lessons, because the goal is to be an extraordinary advocate. And that's what I said I wanted to be. So the only thing I have to do is do extra. The reason I started off with that question is because you can't with us and so with us. Therefore, this that we're talking about, it all starts with us. And at USA Swimming, the way that we truly champion this work is by using the DEI department. Now, DEI, most of the time people see DEI and they think automatically race, they think automatically gender, right? And they think that type of work. However, these words are three standalone words that mean three totally different things. And that's my job as the director of DEI, is to kind of dismantle the myths around what DEI is supposed to even mean. When we say diversity and we define the word diversity, it just means difference. That means everybody's different. White people are different, Black people are different, straight people are different, right? Those who are LGBTQ are different. Everybody's diverse, right? Inclusion. Therefore, if everybody's diverse, then we have to include everybody. Not just the minorities, but also the majority. Also those who can swim, those who can't swim, all etc. Right? But then equity, we start to actually champion equity. Equity is something that we do, and we reach people where they are. So I loved what Sarah was talking about. I love what Tiffaney was talking about, because we do have to reach our communities with equity in mind, which is ultimately we have to reach them exactly where they are. So when we at USA Swimming are talking about this work for drowning prevention, when we mention DEI, I just gave you the definitions of diversity, inclusion, and equity, but how many people know that these words are actually nouns? So we've been telling people to champion DEI and do this work, DEI within drowning prevention, within education, within corporate America, within swimming. And guess what? You can't do a noun. So the reality is I had to find the verbs that champion the nouns. What gets you to seeing the difference in someone? You have to connect with them. What gets you to including others in your policy, including them in your drowning efforts, your advocacy? Well, you have to accept them. You may not always agree, but you do have to accept them. And then lastly, equity is something that you provide. So we've come up with the formula, it's called CIP. We connect with communities, we accept their unique needs, and then we provide for them individually, equitably, right? So when we're talking about this work, I want to first reiterate for us that it's not just a traditional healthcare problem. It's a sports problem as well. And why? Because swimming is one of the only sports that's actually a life-saving skill. So now we're saying we get to close in on two goals. It's not just the goal of swimming fast. In order for our kids to actually swim fast, they have to be able to swim. The more swimmers there are in America, the better opportunities there are for us to win gold. So our goal as well is to get as many kids as we can in the water, as many kids swimming, because it's going to raise the competition level. But also, again, sports is an opportunity for us to nudge the importance of water safety. That's why we bring Olympians to schools to talk about awareness, right? So we can nudge these kids to see that swimming is exciting. Swimming is something that they want to do, and there's so many opportunities in it. Sports promote character, connection, competence, confidence, and we want to use the water to promote that connection. We want to use the water to promote confidence. We want to use the water to promote character and competence. When our kids start to see that they have a relationship with the water, then they start to want to share that relationship with their other friends. They want to share that relationship with the community members around them. And so if swimming is one of the only life-saving, or one of the only sports that's a life-saving skill, then what that means is we have to continue doing extra. We have to go above and beyond outside of just the play. How do we do specific way? Awareness and practice. Awareness and practice. Today, International Water Safety Day is a day that builds awareness all across the country. But what is awareness? It's what kids should be doing just simply around the water, what we should be doing as well around the water. So that's the first effort. Before we start to actually get kids to practice water safety, we have to teach them how to be aware around the water. So we're bringing swim lessons right now. USA Swimming is bringing swim lessons. We're connecting swim lessons to the kids here in separate communities all throughout the United States. But the first that we're is going to their elementary, middle, and high school and teaching them water safety awareness. We're doing that with the core four. Our core four is 1, learn how to swim. Should probably be at the top of the list. Number 2, when you do swim, always swim near a lifeguard. Always bring an adult as well if you're a kid, always. Number 3, swim with a friend. So yeah, sure, it's great that you have a lifeguard and it's great that you have an adult, but you also need a friend because now we have 3 layers of protection. And number 4 is reach or throw, never go. Don't do that yourself. Find a stick, find a buoy, find a noodle, find a life jacket, find something, but do not go in yourself. If you find that you are going in yourself, then you need to grab the side of the pool, grab a rail, grab a stick, something firm, hold your arm out. And if your friend can't reach your arm, you can't go, right? So you need to either, again, call for help, scream as loud as you can, do something, but you can't go out there because then that's risking another life. There was a deeply disheartening story out of Louisiana, probably a few years ago, where I believe more than 4 kids definitely went in to save each other, and each of them drowned, right? And so this is why we teach that curriculum the way that we do. So we talked about awareness. The other piece, though, is practice. How do we get adults? How do we get kids? How do we get those who can't swim in the water to actually practice the skill of water safety? Well, USA Swimming has some opportunities for you all. So first, we have a find a lesson and find a club tool. We're going to throw that in the chat here. If you are looking for lessons in your current area, if you're looking for a club, a swim club within your area, all you have to do is go to this tool. Miss Sarah was talking about this earlier, right? Where can we find these opportunities? Well, you can literally go to our Club Finder tool. You type in your zip code, and it's going to bring all of the lessons and all of the providers and the clubs that are close to your zip code, that are as close as possible. So that's the first piece. For that, though, if you're finding a lesson, I want you to know that we also have grant opportunities and adult learn to swim opportunities there that you can find. We also have youth learn to swim opportunities that you can find. That's going to be in this second link down here. But then USA Swimming is also doing something extremely unique that I won't continue to speak about or harbor on, but I did want to put into this space. We're also going into individual communities and now specifically writing some of the cultural challenges that were put in place by the sport. So what do I mean? We have a historically Black college and university grant that goes out to historically Black colleges and universities to actually bring youth learn to swim lessons to their community. And also to raise awareness about swimming within the historically Black college and university space. We also have something called the Community Impact Grant. It goes to teams, specific USA Swimming teams that are doing community work in which they're giving learn to swim lessons, or they're bringing water safety programs to their community. So if you know a USA Swimming Club that is doing great work within the community and they're looking for some financial support, please connect them with me. But also, if you know any HBCUs that currently don't have a swim team, please also connect them with me as well. because again, our goal is to also ensure that communities that have been historically challenged and disenfranchised around the water also have the opportunity to swim. So with that, you all, again, sports also have the opportunity to save lives, but save lives in conjunction with all of the great work that you all are doing. I look forward to continuing to do this great work with you, and I've been extremely elated and happy to be on this panel. Thank you so much for having me.
Thanks for that, Leland. So I see there have been a few questions in the Q&A that have been answered. Thank you for folks for those. We only have a couple of minutes, so I want to go back to the one question that has not been answered. I think maybe we'll start with Tiffany, because I know she's done a lot of work on this, and Leland. Can you say a few words regarding resources that are available for families that may not have high levels of English proficiency? So this is sort of around the cultural inclusion, linguistic inclusion around, and I think we also should address the issue of historical connections to swim competence and drowning prevention. So let me start with Tiffany and Leland, and then, yeah, please.
Thank you. Great question. A couple of different ways to address this challenge. I think we all know that many organizations are struggling to get the staff and the money that they need to offer better services. So we always have to be realistic within what we see and expect within the community. Here in Arizona, the largest non-English speaking group is Spanish speakers. So in order to ensure that those for whom English is not their first language, to make sure that that group is reached out to and given what they need. Number one, we really act as a role model. Everything that Phoenix Children's puts out in the community is both English and Spanish, and we work at the 4th grade literacy level or lower because there are literacy challenges within these populations. I think the second part of that is making organizations aware that if you were to offer resources in Spanish, we could help amplify and promote those resources so that, for example, our local Parks and Rec group realizes that they could actually get more customers if they were able to offer it. And then I think the third piece is just the compassion piece that I mentioned. Can you imagine doing something really, really scary like learning to swim in a second language? It would be a significant barrier for me.
Okay.
For us, we do have Spanish. We have Spanish resources, and then also we're creating a translator extension within our website. This is something that I'm going to be pushing for. So that way, when you just go to our website, you can click the accessibility button and you can change all of the language within our website, all of our resources to whatever language you see fit. Outside of that, we do have coaches from extremely diverse backgrounds as well, but I would suggest that you use that Find My Club tool. That Find My Club tool should let you know what coaches are available there. And then also it'll let you know whether the club is a gold standard club, whether it's a bronze standard club. And you can find out what those things mean on our website as well. The higher the standard means the more service, the more community service, the more customer service, right? The better the club. And that's the theory that goes behind that. So please scour the website and you'll be able to find some resources there as well. For the second piece that you talked about, Ben, the historical challenges, I'm not going to give you all this long story and this long history, but I'm going to give you this really short and in an abbreviated, abridged manner. So in 1900s, white kids are drowning in the highest rate ever in American history. Why? Because Americans are coming in from other countries. They're immigrating in or migrating in from other countries that are European countries, and they're landlocked. So if you look at the history, the white kids are drowning at a very high rate in the early 1900s. Congress says, hey, we need to do something about this. This happens about the year of 1910, where Congress says, no, we really have to do something about this. So what they do is they bring swimming to schools. They make it a part of the school curriculum from about 1910 to about 1970. Well, what's happening? Black kids, one, are in schools, but they're not in the best schools, and they're not able to be in schools until a very later time, right? We're talking about 30s, 40s, right? And so Black kids don't learn how to swim at the same rate. White kids are learning to swim in schools. Well, what happens in 1968? We get the civil rights legislation, kids integrate, and guess what the schools do? They make swimming private again. Sorry, that's Congress. They make swimming private again. So then swimming is removed from the schools in the 70s. It's brought to public recreational spaces. Well, guess what happens in the 80s, you all? recreational departments started closing because of segregation. Montgomery, Alabama was actually the first city to close all of its recreational department, library, the pool, the basketball gym, and they kept it closed for 5 to 8 years. Now what's happening? Kids aren't going to the pool. Not just the Black kids, all of the kids in that city aren't learning to swim, right? Well, this happened in over 60% of our cities in America. So there's now no option to swim in the schools. There's no option to swim from about, again, the 70s to the 90s. There's no option to really swim out at a recreational center unless it's private. It costs a lot. And then guess what, you all? We have kept this models from the 70s all the way up until now. So it costs to swim. And it's no longer in the schools. It's no longer a free thing. So who do you think loses out? Those who don't have the cash on hand. That's often our racially diverse and also our geographically diverse who live in rural America. So they shouldn't be forgotten as well. So with that, that's the mini history lesson of how we've become so disenfranchised, removing swimming from schools. So it's our job, again, USA Swimming, you can't spell it without us. It's our job to ensure that we're bringing it back as well, because it's all on us.
That's awesome. Leland, you make me, I come across as fairly energetic. You, I love your passion. All right, we're at the top of the hour. I wish we could go on forever. I'm going to turn it back to Gary to close us out, but I want to thank our panelists. If we were together, I would offer the heartiest round of applause. Thank you all for your passion, your expertise, and your willingness to share with us this morning. Gary?
So I would also like to echo my thanks to our panelists, also to you, Ben, for moderating the session. I'd also like to thank the team that worked behind the scenes to make this happen. Laura Datner, Katie Donovan, and Tracy Meehan. So without them, we wouldn't be able to do this. So thank you so much. There is going to be a link to the recording and slides from today's webinar. They'll be sent by email to all of those who registered. And then a very important comment is that please remember to join us today for a Twitter chat at 2 p.m. Eastern time. And you can do that by using the hashtag #PreventDrowning. #PreventDrowning. So hope to see you there, and it's going to be very informative today. Anyway, that concludes today's webinar. Thank you to everyone. Thank you for attending. Take care, everyone.